may be getting...
You can't always.
This is the death
Remarkably
Turn back towards God. Rise up.
Welcome to Vital Signs, your prescription for a healthy family, where members of the Catholic Medical Association explore medical topics vital to the health of you and your family members. I'm Dr. Tom McGovern, the host of Vital Signs, brought to you by Shalom World TV. Today, we explore the often heart-wrenching topic of infertility. The inability to conceive and give birth to children is a cross that more and more couples worldwide are bearing. Infertility has been defined as the inability to achieve pregnancy despite trying to conceive for 12 months. It affects an estimated 48 million couples worldwide. In the United States, an estimated 12% of women 15 to 44 years old, about 1 in 8, are unable to get pregnant and carry a child to term. This infertility rate has been increasing and is partially explained by a 50% reduction in sperm count in men over the past 40 years and an increasing age at which women first try to conceive. For as they age, a woman's ability to conceive drops. Many options are available for women seeking to overcome infertility. Some of them respect human dignity, like a group of treatments known as natural procreative technology taught at the Pope Paul VI Institute in Omaha. And some of them don't, such as in vitro fertilization that, among other things, results in extra tiny human beings frozen as embryos. Today, a young mom from Fort Wayne, Indiana, is going to tell us how she found hope dealing with infertility. Amanda, thank you for joining us on Vital Signs today to share your story.
Thank you so much for having me, Dr. McGovern.
Amanda, early in your marriage, you and your husband tried to expand your family. You noticed that friends were conceiving within a few months of trying, yet after a year of your own trying, you weren't pregnant. What did you think? And then what did you do?
Yeah, in that moment, I think we were a bit confused just because so many friends and family weren't having any issues. And I actually had an appointment with my previous OBGYN at the time. And so I went to my appointment and just happened to mention to her that we had been struggling to conceive after a year of trying.
And that doctor probably recommended something most of us doctors do when you come in. What did she tell you?
Yeah, so she talked to me about it and said, take these pills for a couple of months. And if you're not pregnant, by the end of those couple of months, there's really nothing I can do for you. And at that point, I would refer you to IVF. And so I think it was a tough moment for us because there was little to no empathy in the process. And it was pretty much try this and then you're on your own, it felt like.
So it sounds like you were treated almost like a broken machine, rather impersonally. How did you feel about that approach?
Yeah, I think that's what's been a struggle for me to begin with the entire infertility process. Is just feeling broken to begin with since my body wasn't doing what, it was created to do. And just being told, try this and hopefully it works just felt a little bit dismissed.
And how did you feel about those options that would have involved, the artificial insemination or the test tube babies?
Yeah, so going into our marriage, my husband and I knew that wasn't really something that we would ever necessarily consider. We try as much as possible to follow Catholic teaching, and knowing that wasn't in line with teaching, it was just never something that we had considered. And also, we really knew that sometimes following those things can be a struggle and a cross to begin with. So it was just all part of our story and struggle through that.
So how did you get connected up with somebody who could help you from a Catholic perspective in a moral way to achieve pregnancy?
So I actually had a friend that worked with Dr. Stroud, and we were pretty quiet the first time around. with our struggle. And so no one really knew, but she had kind of gotten word that we had been trying, and she had mentioned that maybe I could set up a consultation with him just for an infertility consult. And so my husband and I sat down with Dr. Stroud for the first time, and it really changed everything. So we sat down, and the first thing that he said to us was, if you go anywhere else around, someone's going to tell you that infertility is a disease. And then he went on to say infertility is not a disease, it's a symptom of underlying conditions, and told us that it was his job to really figure out what those underlying conditions are to get my body working the way that it was made to. And really, in that moment, it was complete peace. It was, wow, someone is looking at me as not this broken individual and wants to help in a way that we're comfortable with to achieve something that we desire.
That's why he's such a popular doctor.
Yeah.
Dr. Stroud, I'm sure, had you do a number of different things. What's a short list of some of the things he had you do that in the end helped you conceive?
Yeah, so I have quite a few issues, but one of my main issues is I struggle with endometriosis. So that's where there's scar tissue in my pelvic cavity outside my uterus. So he's done some separate laparoscopic procedures to remove that scar tissue. And I've also done plenty of hormone panels, working on getting my hormone levels to where they need to be, different injections to help in ultrasounds and things, just to help make sure that my body is in working order in order to achieve and carry a pregnancy to term.
And you now have children, don't you?
We do. We have two gorgeous blessings. My son, John Paul, who's 5, and son, Luke, who is 2.
Thanks be to God. Amanda, what advice do you have for couples who might be watching who are struggling with infertility?
A couple things. So I think for me, I struggled with feeling broken for a really long time, and identifying myself as a good Catholic or not based on my ability or inability to conceive. And neither of those things are true. And I also think for us, we ended up finding a good balance of being open and honest. Is the first time around with our first son, we didn't tell anyone, and there was a lot of shame built up in that. And then before we got pregnant with our second son, a lot of people knew of our struggle, which was beneficial in a way because we weren't so alone. But then we were constantly reminded of the struggle when people were asking us. So now as we hopefully conceive our third at some point in the future, we've really kind of balanced who we're talking to about it. So there's not so much shame, but also not so much pain. And the other thing that I would say is at times it is a clinical and robotic process. And so just trying to laugh with your spouse and just communicate when things are difficult, and also constantly trying to discern whether this is a good month to continue to try, and take those breaks and pray for peace as necessary, because it's not a struggle for the faint of heart, and it's pretty tough. But it's been a journey that I would take a million times over to have our boys.
Amanda, what a tremendous story, and how generous of you to share it with others. Thanks for being with us here on Vital Signs.
Thank you so much for having me.
Joining us today as our medical expert is Dr. Chris Stroud. Chris is an obstetrician gynecologist who practices in Fort Wayne, Indiana, and specializes in the treatment of infertility. He applies methods known as natural procreative technology, or NAPRO technology, that he learned at the Pope Paul VI Institute in Omaha, Nebraska, after completing his residency training. Chris also delivers a lot of babies. Chris, welcome to Vital Signs.
Well, Tom, thanks for having me, and it's a pleasure to be with you and our friends from Shalom World TV.
Chris, after marriage, most women want to get pregnant and have children. Yet many of them don't get pregnant as soon as they'd hoped. So at what point, after how many months of trying to get pregnant, would you recommend that a woman see a doctor to figure out if she's infertile and how to overcome it?
Well, Tom, that's a great question. And unfortunately, conventional wisdom often leads to problems. Most OBGYNs will advise their patients, if you've been trying for a year, and you're not pregnant, maybe there's a problem. Unfortunately, that often means a wasted year and a lot of pain and suffering on the patient's part. I advise patients that if they're engaging in the marital embrace on a semi-regular basis, they really should conceive after 3 to 4 cycles. If not, it's time to start asking some simple questions.
So what are some of these simple questions? What do you do when a patient comes in? How do you start evaluating what isn't going right?
Sure, it's like the Trinity. There are three important things that we like to remember. Category one, is there a sperm? Think back to high school biology class, right? There doesn't have to be 100 million, but there does have to be at least one. So category one, is there a sperm? Category two, is there an egg? Is the woman ovulating? Category three, can those two parties get together? So at the end of every menstrual cycle, we're asking those simple questions. And I think even more important than that is to remember that you're supposed to be pregnant. A woman is designed to be pregnant. She can choose to be, like you, a terrific TV talk show host, but by her design, she's supposed to be pregnant. If she's not becoming pregnant, it means that there's something wrong. And so we need to march through those three categories of questions and determine what's wrong, knowing that we'll find something if we look.
So among these three problems, what are most common? Is it egg? Is it sperm? Is it getting together?
A couple of things that we know. In 20% of couples that are not becoming pregnant, it's a male-only issue. So that's not unheard of at all. But I would say the most common cause of fertility challenges with women are problems of ovulation. Either the woman is not ovulating, or maybe she's ovulating on a haphazard, irregular schedule, or maybe she's ovulating, but it's not a good ovulation, so to speak, and that there may be problems with the hormonal management after ovulation. All things that are very addressable, but we have to look for those and find them.
So, Chris, the first category you mentioned was dealing with sperm in men. There are a number of immoral ways that doctors get samples of sperm. But what are some moral ways that can be done? This might concern a number of Catholic couples.
Absolutely. And also, if we ask men confidentially and they're honest, many of them will all out refuse to do a semen analysis, maybe not on theological, but just on a personal objection level. As a Catholic, I can't suggest to a man that he goes to a lab in the closet and does something that most all of us would agree is immoral and certainly against church teaching. But we have a special way that we get a semen analysis in the Creighton fertility world that I live in. And it involves a special condom. It's special because it has no spermicide, it's latex-free, it's talc-free, there's no lubricant. And then if that weren't special enough, we instruct the couple to make it extra special by taking a needle and put 3 little holes in the end of the condom, one for the Father, one for the Son, and one for the Holy Spirit. And we actually have a nice letter from the U.S. Council of Catholic Bishops that says that is a very moral and acceptable way for a couple to get a semen analysis.
So, Chris, natural procreative technology, also called naprotechnology, what is it and what are the most common methods of naprotechnology that you are able to use to help women conceive?
Sure. It's an approach to fertility designed by the founder of the Creighton Institute in Omaha, Nebraska, Dr. Thomas Hilgers, and a lot of great people that have spent really the last 3 or 4 decades working on matters fertility. But it involves really determining the cause of the couple's infertility and then correcting that problem. Again, as I said earlier, it comes from a philosophical position of understanding that a woman is designed to be pregnant. And if she isn't, there's something wrong. There's a disease process at hand. Absence of pregnancy is not the disease, that's a symptom. Just like pain in one's knee is not the disease, the torn cartilage is the disease. So our job in the naprotechnology world is to determine what is wrong and repair it. Sometimes that means medication to help ovulation. Many times that means surgery, restorative surgery to repair damage maybe from endometriosis or for pelvic adhesions or some other anatomical problem that we can correct surgically, allowing a couple to be open to pregnancy and then determine if they're called to biologic parenthood or not.
Is it true that there aren't that many doctors who do that kind of surgery and the world could benefit from more people like you doing it?
Well, I would argue it's very true. If no other reason, evidenced by the distance patients have to travel to see me and physicians who practice like me. I wish there were many, many more. But it is a problem. We need many more Catholic obstetricians, gynecologists who will actually practice in a way that's quality, good science, and in keeping with the teachings of the church.
So that was a shout out to those of you listening who are considering a future in obstetrics and gynecology. Chris, what approaches to infertility do you consider out of bounds and why?
Well, again, as a Catholic, I can't recommend or use something that's contrary to the teachings of the church. So the so-called artificial reproductive technologies are really ethically out of bounds. So things like intrauterine insemination, or IUI, or sometimes called artificial insemination, when the man's sperm is collected in the way that we referenced earlier, and then placed into the uterus at the time of fertility. Especially, and the best example would be in vitro fertilization, where the woman's eggs are taken out of her ovaries, the man's sperm is taken out of him, they're put together in a laboratory setting, eggs are fertilized, and then they choose the best embryos back in the woman's uterus. There's no moral argument for IVF being acceptable.
For those couples who are infertile or struggling with it and use these immoral methods like in vitro fertilization, how does their rate of achieving pregnancy compare to those who use NAPRO technology?
Yeah, it's very difficult to really track that statistic in a meaningful way because so many couples undergo in vitro fertilization and become pregnant, and they would have become pregnant anyway. So it's very common, unfortunately, for a woman to go to her gynecologist and say, look, we've been trying for 6 months, we're not pregnant. The gynecologist maybe sends them directly to an IVF clinic. They may do a few things and then move immediately to IVF, and that couple achieves pregnancy. Well, that really helps the success rate statistics of the IVF clinic, but it may not be a valid success, meaning that couple may have become pregnant with something very simple and never needed IVF. But in the data that we can look at, those couples using NAPR technology and the Creighton fertility model, they do as well or better than IVF couples, and they spend a fraction of the cost in so doing.
Cheaper and healthier and more moral. That's great. So, Chris, how can a woman find a physician like you who will not violate her human dignity in trying to achieve pregnancy?
There's a couple of ways to approach that. Certainly at the parish level, talking to a priest or a counselor and asking for a Catholic approach, looking on the web for Creighton physicians or NAPRO technology or Creighton fertility model. There's a great website called One More Soul, SOUL, and you can search for NFP-only physicians by zip code or city. So there's a lot of great resources. Be patient and be willing to look. And unfortunately, you may have to be willing to travel. Certainly many, many people do, and they would say that it was worth the trouble.
And what final advice do you have for viewers who are struggling with infertility?
Yes, if a couple feels like they have to choose between their desire to be parents and remaining faithful to church teaching, that's a false proposition. They do not. A couple should never, ever feel as though they need to choose between their faith and their fertility. There is a better way. Find someone who will help you find that better way.
Chris, thanks for being with us on this episode of Vital Signs.
Tom, thank you for having me, and God bless you.
And thank you, viewers, for watching this episode of Vital Signs, your prescription for a healthy family, brought to you by the Catholic Medical Association on Shalom World TV. Please join us for our next episode and share the good news of Vital Signs with a friend, and may God bless you. I encourage everyone to send us emails with questions that you want to ask medical experts. Please email us at vitalsigns@shalomworld.org. Your questions and comments will help us determine what topics we'll cover in the next season of Vital Signs.
someone who's used media a lot in evangelization, so I believe in the importance of Catholic radio, Catholic TV, Catholics using the new media. Can I encourage everyone to watch Shalom TV? I think it's a great vehicle of evangelization. And God bless all of you.